The time is 8:33 a.m. and the Oregon Board of Physical Therapy is entering into public session.
For roll call, Timothy,
Here.
Aaron,
Here.
Sandra,
Here.
Hoku,
Here.
Michael,
Here.
Susan,
Here.
Erica,
Here.
Dwight.
Here.
For staff present, Michelle, Sherry,
Here.
Gayla,
Here.
Sarah,
Here.
Joanna.
Here.
For the record, we do have guests present today. Thank you for being here.
Okay, is that time for motions?
Yeah, Sarah, can you advance a couple pages? Back one. Before we go into motions, as we do at every morning meeting, we just read in the statutory purpose for the board, which is to protect the public health, safety, and welfare for all Oregonians by maintaining standards for quality care, professional skill, and competence through the effective regulation of the practice of physical therapy. And with that, the next item is board motions as a result of executive session.
Okay. Madam Chair, in case number PT 780-10/22, I make a motion to offer settlement agreement.
I second the motion.
Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Michael,
Aye. Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Okay, next case.
Madam Chair, in case number PT 781-10/22, I make a motion to close and refer case.
I second the motion.
Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously.
Okay, next case.
Madam Chair, in case number PT 861-01/24, I make a motion to close case.
I second the motion.
Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously.
Next case.
Madam Chair, in case number PT 889-12/24, I make a motion to close case and issue license.
I second the motion.
Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously.
Next case.
Madam Chair, in case numbers PT 881-11/24 and P 882-11/24 and PT 890-01/25, I make a motion to ratify the administrative closure of these cases.
I second the motion.
Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Oku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously.
And Madam Chair, there are no more motions at this time.
Next slide. Consent agenda items. These materials were sent out to board members ahead of time and are also available in the meeting materials packet posted online. They consist of the minutes, list of licenses that were issued for review and ratification, and the director's report. Sarah, one highlight that I wanted to make, if you would be willing to go to page 6 of the executive director's report, the agency expectations dashboard. On that, and if you're able to zoom in just a little bit there on that, I wanted to highlight that the update that we did successfully complete the requirements that were due as of our last meeting. And the items that are now in yellow, we use a very conservative assessment that if it's pending, but has not yet been completed, it's going to stay in yellow status if it's near due. If we had missed the mark on something, it would have been in red on this display. So you get the agency status and some notes on that. And what this shows is that there are 3 items that are pending. There is the 360 agency director evaluation, which is currently in process, due at the end of this month. And then the next major effort will be the work on the strategic plan and DEI plans, which are both due in June. And I'll talk more about strategic planning and that process later in the meeting. So with that highlight, are there any questions or corrections on any of the materials in the consent agenda item?
Madam Chair, I move to approve the consent agenda items as written.
A second.
Motion made and seconded. Roll call vote, Timothy,
Aye.
Aaron,
Aye.
Sandra,
Aye.
Oku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries unanimously. Next item on the agenda is an opportunity for public comment. Are there any members of the public who would like to make comment to the board at this time? If so, if you could use the raise hand feature, and the chair can recognize you. Madam Chair, I am not seeing any raised hands at this time.
Okay, we can move forward.
Next item is one of the standing items for delegate reports for the organizations to which we have delegates, the Federation of State Boards of Physical Therapy and the PT Compact Commission. At this time, it's an opportunity for any of the members or staff who are serving on any of the committees in these 2 organizations, if there's anything to highlight since the last meeting. Erin, did you have any updates or anything to highlight? I'm not sure that much has happened over the turn of the year.
Yeah, I did attend a meeting in December 16th for the annual meeting where I was looking, I could not remember of the person that we elected to be the new leader of that area. So I apologize, I don't remember her name, but there was somebody had been on the committee for quite a long time directing and then is off, and we nominated and elected a new person, and I cannot remember her name.
Corey Tillman Wolf.
Thank you.
Yeah.
But I was like, I know that it's a hyphenated name. So yeah, so I think that's really the only update I have. It was very informational. Yeah.
And it's, as some members may remember, the very first chair of the PT Compact Commission was an Oregon board member. And the chair, Kathy Arney, who just rolled off, was also one of the original founding members in establishing the compact. So sort of the last of the original individuals that had been involved in the startup of that organization since 2014. And Corey Tillman Wolf is the executive director of several boards in Virginia.
Thank you.
Thank you, Erin. Any other updates from any of the other committees for PTCC? I don't know that any of the committees met in that time frame. Okay. Federation committee reports.
Hi, Michelle. So I'm on the Animal Physical Therapy Task Force. There's just been some initial organizing. The task force has not met yet.
Great. Any other highlights from Federation committees? Couple of highlights for upcoming webinars and trainings that have been scheduled. There is an open to anyone webinar on January 30th, which is focused on legal cases across the US. And then a reminder for board members that in April there is the regulatory workshop, which is an excellent opportunity for focusing on regulation and for interacting with your counterparts from other jurisdictions. That event is limited to board members or staff. There are both virtual and in-person options. And if you have any questions, we're happy to give more information after the meeting. Any other highlights or questions on this section? Next item. Madam Chair, the next item is the election of board officers and FSBPT delegates. The first question before you is consideration of extending the term of the current chair and vice chair by a 6-month period. The assignment of delegates and officers here in Oregon for a number of years has been tied to the fiscal year. The Federation has shifted their timing where it makes much more sense if we were to align with a calendar year. So the question before you is if you want to entertain a motion to extend the terms of the chair and vice chair by 6 months to create that calendar alignment.
Is there discussion on this, or? I move to extend the terms of the current chair and vice chair by 6 months to December 31st, 2025.
I second the motion.
Roll call vote, Timothy,
Aye.
Erin,
Aye.
Sandra,
Aye.
Hoku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, the motion carries unanimously.
Michelle, I didn't hear who seconded. Did somebody second that?
Sandra did. The next question before you is, with a new year, is the need to elect the FSBPT delegate and alternate delegates. The delegate represents the Oregon Board at the Leadership Issues Forum, which is in July, and at the annual education meeting. So travel and representation at both of those events is required as part of the appointment. And then the funded alternate delegate would also attend the annual education meeting. Delegates and alternate delegates participate in the election for Federation officers, and also are a primary conduit for bringing information back and forth between the Federation and Oregon. So at this time, Madam Chair, is for the board to discuss who is interested and able to serve in these roles. And then if more than one person is interested in a role, then you would hold a vote. And then after the vote, then there would be a motion to elect the delegate and alternate delegate. So I will turn it over to you for that discussion.
Okay. Does anybody have interest in being delegate or alternate delegate this year? If the dates work for you and you haven't done it yet, I'd really encourage you to do it. It's very good education and conference, and just great to see what other states are doing. Pretty eye-opening.
I would be interested in one of those.
Okay.
I,
Do both,
I'm
Susan, do both dates work for you? Like the July and,
Yeah,
yeah, and I am also interested as well, but if other people want to go, fine with me as well.
Erin, were you alternate delegate last year? Or,
Yes, yeah.
okay. Anybody else interested? Do we want to, oh, go ahead, Dwight?
I'll
was gonna-
wait till next year. I got staffing issues right at the moment, but I would love to, but I need to wait, make sure I got my
Yeah.
stuff
Okay.
taken care of.
Susan and Erin, do you have a preference of delegate and or alternate delegate? Should we?
well, if Erin's already been the alternate, maybe she should go to both and be the delegate. In
and then
fact,
Susan-
I have a motion to elect Erin as the delegate, the 2025 FSBPT delegate, and Susan as the 2025 FSBPT alternate delegate.
I second the motion.
First and second, roll call vote. Timothy,
Aye.
Erin,
Aye.
Sandra,
Yes.
Hoku,
Aye.
Michael,
Aye.
Susan,
Aye.
Erica,
Aye.
Dwight.
Aye.
Madam Chair, motion carries. Congratulations to the newly appointed delegates.
Thank you. Good job,
Thank
guys.
you, Susan. I just want you to know you had a choice.
All of us caretakers here.
Very nice, thank you.
Next item, please. The next item, this is also a standing item to do a strategic planning progress review, kind of an update between the meetings, since we are in January and have put 2024 behind us, which is sort of the end of the prior strategic planning window. The board, of course, has already started the process of the next 2025 through 2030 planning process, but this is going to focus on the materials that sort of close out the current strategic plan. The frameworks that the board has been using for the current body of work are the frameworks or the lenses, if you will, around culturally responsive regulation, trauma-informed regulation, and a focus on prevention. Next slide. And I will note on the prior slide, and it'll come up again on another slide, there's a link at the bottom of that that takes you to the full strategic plan for the agency, which is also posted under Budgets and Reports section of our website. This slide summarizes the different identified strategic priorities and action items that the board had established really since 2018. You'll see kind of the fourth category here about continuity of operations, or sort of the internal readiness of the organization. And priorities and action items in that area were in modernization of IT systems and operations. 2020, of course, saw the biggest shift for us from 20-year plus old system with predominantly paper-based processes to an online system. Frankly, it couldn't have been better timed than February of 2020 at the time on that. You may recall that the prior director and other staff, there was a significant turnover and loss of knowledge, potential loss of knowledge. And so handling the turnover in staffing was within that frame. And of course, there was a lot of responsiveness required during the pandemic years for facilitating telehealth practice and adapting or addressing the impacts from the COVID-19 impact. As you may recall, that included adjusting renewal timelines and continuing competency requirements in a number of actions that the board took in rulemaking and policy and temporary emergency actions. I will also say for the next two buckets, you could probably move these boxes back and forth because I think of the lenses as a glass box that you can pick up. They are interrelated. So through the lens of culturally responsive regulation, work that was done to update continuing competence requirements to allow different kinds of outreach support of practitioner wellness, to give credit for those other kinds of coursework that could be brought. There was also the implementation of cultural competency requirements and work with integrating that into the process. We did work with the Oregon PTA schools to hold essentially a summit on educational pathway efforts that different organizations, the different schools were taking to do sort of a knowledge share, brainstorming, and provide some visibility into the state's workforce data and highlight some of those projects. That group has not met in about a year. There has been a lot going on at the different school communities, but it's certainly something that I think would be good for the board to consider continuing that work forward into the future. Working with other organizations, APTA Oregon is one of those to address workforce and have those conversations about how do we increase the workforce availability and diversity. Still pending on this, we've done some preliminary work on the update to the mission language to further incorporate into the state DEI vision statements. And there's also been a focus on internal training for staff and board members around bias, and as we move over to the other category, trauma and the impacts of trauma. One of the key strategies that we had, and Sarah is, of course, the living embodiment of this, but a focus on data and being able to do the reporting and analysis of the data that we have in order for you to have better resources to make more informed policy decisions. We had a focus on graduates of non-CAPD programs that were applicants, and really evaluating the impacts and the equity of the expectation for applicants from both CAPD and non-CAPD institutions, which resulted in rule changes, and I think is informing and educating some of the weaknesses that we have in the current statutory language that's being communicated. There's been the collaboration, as mentioned in the other, and of course, the training that falls through all that, through those categories. And then finally, through the lens of focus on prevention, an increase in outreach and education to the general public, to students and to licensees in the form of visits, materials on the websites, videos, webinars to target and really help from the perspective of if we can create an environment where there aren't violations of law for whatever reason, then we are doing a more effective job of protecting the public. There's been a special focus on addressing practitioner burnout and moral injury, really understanding that and the complexities around that and the impacts that can have on practice. And another effort that we undertook in 2 renewal periods in the time period was to review submitted continuing competence prior to the close date for the renewal process in order to help people correct potential issues before the close date, at which point it would become a violation. And so we put efforts into helping people be successful in meeting those requirements. Next slide. So if those are the initiatives that were identified for the board, this is out of the State of Oregon's Diversity, Equity, and Inclusion Action Plan. And they also had broad strategies for the work that agencies do. It's a little small on the screen, but if you see on the right side, there are numbers 1 through 10 that are associated with each of those strategies. And they include things like number 3, foster inclusive communications, number 7, advance contract equity and improve state procurement processes. So this was another reference point that the board has been using in determining the specific actions that you undertook through 2024. Next slide, please. So this one's a little bit harder to see if you can zoom in on your devices, or again, these materials are posted in the PDF on the website. But this is a view of those different lenses that you've been using over time. And you can see starting in 2020, when the work on the educational pathway, COVID-19, in 2023, you see the non-CAPD educated RAC, or Rule Advisory Committee, work began. And then you can see into 2024, what we've added are the updates of the primary actions, if you will, under these initiatives that you saw on the earlier pages. If you note the numbers that are listed under each item, those numbers are tying back to the DEI strategies that were identified by the state of Oregon to show that cross connection as well. So you're seeing the 2 viewpoints of the work that fell into the framework of strategic initiatives that you had identified for culturally responsive regulation. Your actions also mapped to the DEI strategies plan for the statewide plan in these ways. Next slide. Same format, same time scale. These are the items that were categorized under the trauma-informed regulation. And you can see the 2024 in particular, there was a lot of focus on where 2023 and 2022, we had done a lot of training and exploration and working with other experts, here what you're starting to see is that Sherry in particular in her roles on the Boundaries and Sexual Misconduct Committee for FSBPT and with other organizations, CLEAR, has been very active in working not just within the PT board, but within the broader healthcare professional regulatory community, particularly around trauma-informed investigations, and has been having those conversations and bringing that information back and beginning to bring the work that you have been doing as the board and beginning to reach out and collaborate with or align with other health professional boards here in Oregon and frankly across the country. And then focus on prevention over time, and then the highlights, a lot of focus on outreach in particular, and the work with our rule advisory committees. The Division 40 Rule Advisory Committee in particular has done a significant amount of work over the last many months since roughly mid-2023. That's, of course, a future item on today's agenda, which is pretty exciting. And also recognition to the community that was involved in the prior rule advisory group in 2022, 2023 on the non-CAPTE educated applicants. Also a significant amount of input and collaboration participation from the community. Next slide. So with that, and I will pause in case folks have questions and we can go back. If that's a look back, if we look forward, we will continue the process that you started in September, most substantively in the March and May meetings, to plan what comes next. The target that we're looking at is June, the end of June. And the process will continue as we've done for many years. Will include outreach and public input opportunities to get that information to you and to help your process in developing the next strategic plan for the agency. And there's the link to the current plan as well. And with that, I'll pause if there are any questions.
Hi, this is Hoku. I can't see where to raise my hand on Zoom. Anyway, I just had a question about how the administration change here in a few days, like how that might affect the DEI initiatives and that sort of thing. Yeah, I wonder if you have any insights on that, Michelle.
What I can say is there, as a state agency, our DEI initiatives and the work that we do is all still in place. And Oregon is also a sanctuary state. All of those state laws and all of the DEI plans under Governor Kotek are all just as much in place as they were under any of the prior administrations. So there is no direct change with a change in administration in DC. There may be things going forward that if there are changes in federal law that need to be reconciled with state law, there may also be impacts in funding of programs that don't typically, would not affect this work directly, but could be something that could happen in the future. So said more simply, there is no impact now. All of Oregon state laws and intentions are in place as they were last year and the year before.
Thanks, Michelle.
Absolutely. I'm not seeing any other questions or comments. The one comment that I would make is and increasingly long-term public servants. It continues to be an honor to work for this board and to work with you. I am quite impressed with the amount of work that you've done as the board and the intention and thoughtfulness that you've put into strategic planning. And I think it shows. And I think the community at large sees that and appreciates that as well. So my thanks to you, and I'm excited to be able to continue this work and look forward to what develops over the next 6 months. I think one of the changes that you've brought forth that I think is great for access and transparency is a shift in the use of the roundtable and standing agenda item to also a focus on discussion of future agenda items. So what we'll start doing is showing you the topics that you have brought forward that will be scheduled into future agenda items that we can then discuss in public session or bring in other speakers on. So this is the list that was put forth out of the last meeting. And some of these may be trainings, for example, the Oregon Ethics Commission, Public Meetings Law. I have reached out to them. They have not yet had a chance to get back to me, but I'm hoping that we will be able to bring those trainings somewhere adjacent to the March meeting. So with that, are there any sort of comments or additions at this time on these items? Tim?
I'm curious if we should have a discussion, future topics of the impact of payer authorization on directing or influencing the care of a physical therapist provided by the physical therapist.
Okay, we can add that to the list.
I wanted to mention, I guess I'll use the word anecdotally. Anecdotally, this year, we are going to start using some form of AI to assist with documentation at my place of employment. And so I'd be happy to update kind of how that looks and kind of what we experience with you guys, since that's one of the topics. I honestly don't recall the name of the company that we're working with, but anyway, it'd be really maybe even an interesting speaker at some point for us. They had a lot to say about regulation. I even asked them about it. So anyway, just wanted to put that out there.
Thank you. And we can follow up with you offline to get the name of the individual and follow up, or of the company, I mean. Other thoughts? The objective here is that you will start to see these populate future agendas. Okay. Next item. The rule amendments to Division 40. What we have for you, of course, the Rule Advisory Committee had put together the recommended rule language that you reviewed at your last meeting. And then that was published in the Oregon Bulletin to start the process of the broader public input process for administrative rulemaking. Next slide, please. And can you zoom in a little bit, Sarah? They're, I think, reflective of the tremendous work that the Rule Advisory Committee did there really weren't that many comments in the official public comment. We did receive one comment that was asking for a clarification that was actually about existing law and not something that was proposed to be changed. Just wanting to understand something a little bit better. So Sherry, of course, followed up and provided that clarification. The biggest comment, or actually all of the comments, pertained to the section on general standards for record keeping. And the request was that the board add clarity to the proposed changes in section 3, and we'll see that in a moment. There was concern that the language, the way it was originally drafted, might have been misconstrued to suggest that documentation wasn't going to be required at all if a licensee didn't have access to the patient record, which wasn't the intention of the original language. And then there was also some verbal and written comments at mostly a school practitioner-based forum that came up about the meaning of that same section, as well as part of section 2, seeking clarification on the difference between documenting something and completing the record. Can you have handwritten notes that are substantive enough, or does it have to be that final version of that record that you're keeping? So the bottom half of this page shows you the screenshot from the proposed draft, which has all of the markup on it for the originally proposed language. The next page in the document, I tried to make it a little bit easier to decode there. Without the markup on the first half, part 2 and part 3 of this rule section, that's what the Rule Advisory Committee had developed and that you reviewed and went forward into the publication. So if we use that proposed change as the base, based on the public feedback, what we have here are some adjustments to address the public comments and hopefully bring the clarity that folks were looking for. The words in bold are the additional words. There is no substantive change from the proposed rule. In the first one, it's just adding a little clarification about sufficient and what sufficient is. Used to say on the date, this clarifies on the same date. And then in part 3, the primary change is a stronger tie to that part 3 is referencing part 2. And that in the examples here, there was one example, but being more clear about that this is a such as, but not limited to, and then an additional example being added to that. It is adding more words to the rule, but the feeling was, given the kinds of questions that were coming up in the different kinds of care settings, that it would be helpful to have a couple of examples and make it clear that those aren't the only examples. So that's the summary of the public input. I would, Madam Chair, if it's acceptable, since Jeannie from the RAC is here, I don't know if she has any comments on that, but would it be okay to extend that offer?
Oh, Michelle, public comment period's over, isn't it?
Yes.
And are you inviting a member of the public to make comment on the rules?
I was asking a member of the Rule Advisory Committee if she had any comments on the process.
Okay, we just would need to be very careful that there's no, because if you, for the board, the issue is public comment once it's closed. If you allow any public comment, you need to reopen the public comment to everyone.
Okay.
This is not a board member, so.
All right.
Yeah.
Then probably my apologies, Jeannie. So it's not misconstrued on your comments. We should probably hold off on that a moment. Okay. Michael?
Thank you very much to the Rules Advisory Committee and staff for putting this together for us. I just want to make sure I'm interpreting this correctly with sufficient documentation has enough detail to fully represent the encounter. I guess what I'm thinking of is interventions provided. But so like what happened, but things like the clinical interpretation, development or changes to goals, development of the plan of care for a first visit, would be required to be completed within 7 days, but not at the first encounter. So is that close?
The intent is, particularly in some like acute care settings, what the rules have they've always tried to account for different care settings, and ones that use electronic medical records and ones that don't. And this idea that you might be out in the field, or you might be in a school, or you might take paper notes that later get transcribed into an electronic system, or you may only have a paper system. In all cases, whatever happens on that day, you need to have the sufficient documentation of whatever happened that day. And what that means is, if it's sort of if somebody else had to step in the next day and make use of your notes or whatever is documented here, it has to be complete enough for whatever is required from whatever that encounter was. It might still have abbreviations. It might not be fully written out, right? If it's the practice that gets put into another system later. And then the change in 3, it's no more than 7 calendar days. But if you're in an acute care environment, waiting 7 days is probably not appropriate for that care setting, because they're seeing another provider the very next day or later that day. And so if you're working in that care setting, then you need to have the records in. The underlying concept is that the information needs to be there so it's available to the next person who needs to treat or work with that patient.
Yeah, thank you for that. And I completely understand the need in acute care to have timely documentation in the record and available. I think I'm just trying to sort out the 7-day part, especially thinking beyond acute care. And if this would be a new requirement to have like what extent of the note to be done on the day versus what is required for 7 days.
It is worded differently. In the past, you had a record and a permanent record, but the timelines haven't changed. The timelines have always been, the initial record, it was called, had to be the date of the service. And the permanent record, it had to be put in the permanent record before no longer than 7 days. So those timelines haven't changed. They've been rewritten because there was a lot of feedback that there was difficulty understanding the difference between a record and a permanent record, particularly for folks in care settings that use EMRs because they're so used to it, you take notes directly into it. And there's the flexibility in the timeline because there are, in the school setting, for example, you are effectively out in the field, right? And it may be a while before you get back to what is the patient's permanent record. Sherry, I don't know if you want to add on that.
Well, I'm just, thanks, Michelle. I'm just looking at what the rule currently is. So the rule has number 2, it says a record shall be prepared on the date the physical therapist services provided. So we still had that rule. We just clarified because we were changing record and permanent record. And then if you skip down to number 6, which we don't have here, number 6 says either the permanent record or record prepared on the day of service. So that part is changed now. Shall be readily accessible to a licensee prior to when that licensee provides subsequent treatment to the patient. So this kind of goes with number 6, that before someone else sees a patient, there needs to be something documented so that person knows what it is they need to do next.
Sarah, can you scroll back to the page? Because I think
it's up there.
it shows through part 6.
Yeah, there you go. And I think if you go even down or up or whatever, whichever way you want to call it, you can also see what current number 2 says. Yeah, there you go.
Yeah, the only change in number 2 was from a record to written documentation.
Right. Well, that one, we're changing it more now.
Yeah, we're making it clarifying sufficient documentation.
Sufficient, and meaning that's everything that happened on that day.
Yeah, and there is ambiguity in the language because there is variation among the different care settings. And if the rule gets overly prescriptive, then it can create an undue burden in some settings and not others. The ambiguity that's there is intended to convey the intent of what's expected, but allow some flexibility or variability across the different care settings. But Sherry has a good point. It's hard when you look just at 2 or just at 3, but 2 and 3 are all part of the same section. And so you do have to read them in conjunction with the other points as well.
Michael, are you concerned that if we make 2, add that more detail to number 2, it will get like narrow you down too much?
Well, I'm just thinking, and I don't know how often this happens, but so you're seeing a patient in an outpatient setting, for example, and you take notes on your tests and measures and interventions, and you're proposing a plan of care, but you do need to go back and like you might need to consider talking with the physician or figuring out what your clinical interpretation is. Yeah, and those are like often things that happen after that day or the next day. So you've got you recorded the tests and measures that you need in the note and like point of care, but like in the case of an evaluation, like you may be going back to complete that, for example, the next day. And so I'm just in my head, I'm just kind of sorting through like fully represent the visit, like what that, if that would, like in my head, I was trying to make a distinction on like, how do you know when that's there and how do you know when it's not there? But thanks for the discussion. I think I understand.
I have the same question. I kind of go back and forth between, is it better to be there or not, depending on, from the comments we get, some people want it more detailed and some people want it less detailed. So I think either way, we're going to get questions of, this is too vague or this is too specific. So I sort of vacillate also between which is the better way to do it.
I think it might be, Tim has his hand up. Tim?
I see what you're talking about, Michael. If you're in a situation where you're designing the plan of care, but you need some feedback, say from the surgeon or the physician under those cases. But I wonder if you, in the need of getting a signed document, if the plan of care is you have a conversation to meet with a physician before finalizing the full treatment plan. there may be a way to work around that, but I hear what you're saying. On both sides of the coin, it is a gray area because you don't want the note to be left open, waiting for feedback, which may take a couple days for the surgeon. Yet at the same time, you want that feedback to help create the full plan.
Would it, would you have in your notes, Michael, in that particular situation, would you have a notation that you're seeking additional input?
Yeah, I think so. I think it just the way I read the sufficient would mean that you've got a substantive record of everything that you saw and did with a patient on that day.
Yeah.
And then you have 7 days to kind of fine tune it.
Up to, yeah. Sarah, can you scroll to the next page that shows the
This is Joanna. I'm wondering, so generally, when you're modifying a rule after it's gone out for public comment, if there's a proposed change that the public would not have been aware of, such that they could give you more feedback on it, it would need to go back out for further public comment. Do you think that's what this would be?
I don't, our internal take on this is that there's no substantive change. You know, it's trying to add clarity to what the original intent was or what the current rule was. So I didn't think that it reached that threshold.
Well, and I went in with the same, until this discussion, I
Mhm.
actually had the same impression. But I'm wondering if that addition of the word sufficient and the definition of sufficient has changed it enough it should go back out for public comment. But I will leave that to the board to decide.
And I think, Sarah, are you able to shrink it and show both the top and bottom versions on this page? Like if you, so we can see both twos.
I think for number three, I don't have concern because it's just, we just clarified a little more with that, but not limited to. But I do think with number two, people's definition or perception of what sufficient means may be very varied, very varied. The more we have this discussion.
And so one thing you may want to consider is to leave two as written at the top of the page, which is frankly what the current rule is.
Right. And then then it seems to be clarified a little more in three if the board wanted to go with the change made to three.
Mm-hmm. And then if there were, you know, questions that come up, you know, you could come in and do a future rule revision or add a new rule that defines what sufficient written documentation is as a separate action.
I'd love to hear from other members of the board too, to make sure I'm not overthinking.
Well, I come from an acute care world, and this is something we actually do struggle with. I get asked, hey, was this enough in the documentation, or do I need to call the therapist to finish their documentation? And my answer is always call the therapist to finish the documentation. And so I think sufficient is a really tough question, or is where I'm struggling too, because I get asked this unfortunately quite frequently. So I would rather not have the word efficient there for number two. But I understand the why this was proposed or recommended.
Susan has her hand up also.
I mean, I think it's, for me in number 2, it's the definition, sufficient doesn't bother me, but when it says to fully represent the encounter, because that's like how much detail fully represents that. Like with the idea of school-based practice has come up in the impetus for this, and you know, we would write it very, you know, a brief note of what we did enough to remember to get back to do that. We run into it in the clinic when we switched over to the EMR, and I might have a 30-page Peabody that I can put the results in my eval, but now with the EMR, I have to put that in a basket and it gets scanned in, and that, I don't know when the office is going to get to scanning that in. So without all the details of the bot or the Peabody, is that you know, fully, it doesn't fully represent, I don't have all the numbers in there, but my summary is in there. So we've adopted, you know, sort of that, you know, I think that's the part does it fully represent? Does it have, you know, like you said, all your interpretations and all of that, or just the objective piece of that? So it's, I mean, sufficient is vague, but when it says it has to fully represent the encounter, that's where the detail piece gets, like, how fully.
So what I'm hearing is that it would probably be best to stay with the current version of number 2 that you've have currently proposed. And that the edits to address some of the questions potentially could cause more harm than help. How do you feel about part 3 and the edits, the bold text that's in part 3 relative to what you currently have proposed? Do you like those edits, or would you prefer to stay with the original proposed amendment language?
I personally don't have any concerns about 3. And then thanks, Susan. I think it's the fully represent part that I just got stuck on with 2. So.
Let me clarify then, Susan and Michael, do you want to keep it as written?
Well, yeah, I mean,
you want to add the word sufficient?
like I would propose either keeping 2 as written, where it says written documentation shall be prepared on the date physical therapy services provided, or changing it to sufficient written documentation shall be prepared on the date physical therapy services provided. But strike the bold part, so that there can be some interpretation for what sufficient is.
Yeah, I mean what's sufficient for me to know what I need to know to put in there might be different depending on the practice setting, depending on the patient, you know, the details of that particular, so yeah, like I said, I mean, I don't have a problem with the word sufficient at the beginning of number 2. It's just that last part of defining sufficient.
Okay. Sarah, are you able to do a markup to strike that second sentence in part 2? So like that?
Yeah. Do you need a motion, or like is there other discussion?
Yeah, when would this, like if this rule, when would it be effective?
So that I wanted to ask the board because there aren't a lot of what I would call substantive changes. There's I think some better language, but I don't think you're changing a lot of requirements. But at the same time, there is a change and people will want time to review the proposed language. So you may not want to make it effective tomorrow. But I wasn't sure what you felt would be an appropriate effective date. The 1st of February, the 1st of March. How long is enough time for notice and before people comply with the new version of the rules? And either way, we can send out notice of, should you adopt rules today, we would send out notice the beginning of next week.
I would think the 1st of February would be too soon, because I would think people would need time, at least from people who I've been talking to have like a staff meeting. Everybody get together and be on board of, okay, the board came up with new rules, this is what they are, do we need to change anything? Especially some of the ones around reassessment or reexamination. If there's anything that needs to change, like in an EMR, like maybe they automatically have something saved in that says the word reassessment, or something like that they need to make some changes clinic-wide.
Dwight?
4 to 5 days?
Make me do calendar math.
So that'd be
Yeah.
around March
I'm gonna
1st.
need a date on that.
Well, that would be roughly March 1st.
Yeah.
Okay.
Tim has his hand up also.
I was thinking the minimum of 4 weeks. 8 weeks would be an easy acceptance for most organizations. 4 weeks, I think, would be appropriate planning.
Does March 1st work? Okay.
Yeah.
All right. Madam Chair, I move to adopt the proposed rule amendments to OAR 848 Division 40 as amended to be effective March 1st of 2025.
I second the motion.
First and seconded, roll call vote. Timothy?
Aye.
Aaron?
Aye.
Sandra?
Aye.
Hoku?
Aye.
Michael?
Aye.
Susan?
Aye.
Erica?
Aye.
Dwight?
Aye.
Madam Chair, motion carries unanimously. And I do also want to extend my appreciation to the Rule Advisory Committee, everyone that participated in that. And a reminder for the board, they're not off the hook yet. There is still the continued work on discharge, and we can also talk to them about this question of sufficiency to see what their thoughts are and bring back any thoughts or comments that they have back to you. And Michael?
Yeah, thank you. I echo that. I really appreciate all the work from the committee. And about sufficient, like, I think that was my question. Can we send, like, as we send a communication, is it appropriate to say sufficient may vary by your setting and the situation? Like, I don't know that has to be codified, but I guess that's a question, but that's what's in my mind, that sufficient would vary in this a little bit by setting, but and also like on what happened in the session. So
Yeah. Okay. Next item. Rulemaking forecast. One of the other, in the interest of transparency and involvement, what we wanted to start doing at the beginning of each calendar year is give the board, give the community a forecast of what we're anticipating for future rulemaking topics. in part to see if that generates any interest in anyone wanting to be part of these kinds of discussions and rule advisory committees in the future. So next page is a document that is our current working calendar. And Sarah, if you could, thank you. This is our current forecast for what rulemaking in 2025 will be. It is a session year that I'll talk about in the next item. So it's a little hard to predict. And you'll see that we're being a little bit conservative with some topics that we might have otherwise brought forward. But January through March, what we talked about in the prior session on Division 40. March through June, we know that we need rules to implement predetermination requests, which is a new statute that goes into effect July 1, and rules to implement that applications that are received under the licensure portability in the Service Member Act. That's also 2 agenda items later. And we are headed in toward a new biennium, so the public budgeting and rulemaking process that's tied to the adoption of the 25-27 biennium budget. And then for July through December, there are a couple of question marks. We know the Physical Therapy Compact Commission, the PTCC, if they're going to do any rule amendments, that typically happens in the fall. And we, of course, need to have you as the board review those and then adopt into Oregon rule those rules before they go into effect. But the big question mark is the rules required as a result of legislative session. And a session starts very soon, so we don't know the level of rulemaking that we might see with the concept that the association is bringing forward. It may end up being a significant body of work. So this is just a forecast, so we can publish that, and we will update this and add to this throughout the year. Any questions on this or this process? Next item. We are headed into Oregon, of course, has what they call their long session every other year in odd years. And we are headed into a long session. It has already started up. I'm currently sitting in Salem, right across the street from the Capitol building. And there's already quite a bit of buzz here. If you go to the next page, what I've put together here is a preview or an overview of the legislative process. So, Sarah, if you can zoom in a little bit. The first piece of information is the time frame for legislative session. The official start of session is on Tuesday. And what they call the constitutional sine die or end of session is June 29th. That means the legislature cannot be in session any longer than that date. They typically aim for what they call a target sine die, or they attempt to try to end earlier, usually mid-June, but it can go as long as the end of June. The bill deadlines, these are dates that are very important because they impact the amount of work that we see as an agency in state government. The first bill deadline is the date that legislative concepts, LCs, those draft requests have to be submitted. That is the first limiter on the number of bills that we might see. I can tell you that there have already been roughly 2,500 bills that have been dropped and will begin being read into that, but bills will continue to drop. We typically see somewhere between 3,000 and 5,000 bills in an average session, any one of which could have an impact on the agency. The final date to introduce a bill through the committee process is the end of February. And then you get into these concepts of the chamber work session. Bills, of course, go to both sides of the legislature. So if a bill is a Senate bill, it starts out on the Senate side. That's its first chamber. It has to have a committee post a work session by March 21st. And then it has to be voted, there has to be a floor vote by April in that first chamber. And then, of course, the bills switch sides and they go through the second chamber, and you see those deadlines there. So for us, what that means is by your March meeting, we'll know what bills have been introduced. One thing to keep in mind is some bills are placeholders, or they may change. So if they have a relating clause, such as public health, the text of the bill could change later in session and have something to do with physical therapy. But we'll also have a sense of bills that have maybe not even had a public work session yet by the date of the meeting. By the May meeting, we'll know the bills that didn't get out of second chamber policy committee. There is a way for bills to stay in other committees like the rules committee. So even though we'll have a forecast of a number of things that, and they call them dead bills, where they stall out and don't go any further, there may still be some that move forward after that. I think the biggest highlight here, if you scroll up just a little bit, Sarah, is that this is a significant body of work for agency staff in order to monitor all of the bills. Not so far, Sarah. That'll work. So part of why, as far as other efforts and when you're doing, looking at strategic planning, this is a time that in working through the thousands and thousands of bills, we're required to review all of them, see if there may be an impact to the agency, anything that may have an impact, bring to you for discussion. And then any bill that might have an impact on the agency, we also do what they call a fiscal impact statement to make a projection of how it would impact the agency operations financially. Known legislative concepts that we have at this time. All these links are clickable in the PDF if you want to follow through to any of the bills or the piece. We, as an agency, the board has no agency legislative concepts. However, all executive branch agencies support the governor's legislative priorities and recommended budget. So our agency's stance on any of those bills or anything coming out of the budget are in support. We do know that, and Noel is here if anybody has any questions, the APTA Oregon is working to have a legislative concept introduced that would effectively implement the Federation's Model Practice Act. And that work is moving forward. Noel, did you want to comment on that?
Thanks, Michelle. Noel Tenoso, member of or representing APTA Oregon. I'm also a liaison for the association and the agency, and I also serve on the Government Affairs Committee. And yeah, yes, we've been hard at work at preparing a concept. I want to thank the relationship we have with the agency, and in particular, Michelle, who's been a great sounding board and resource for us in integrating the Model Practice Act to our Practice Act currently. And, you know, it solely needs upgrading. It's been a long time to help with clarity and help with access, and as well as just updating what current practice is for physical therapy. And also, I hope to achieve some of the strategic priorities you guys have as an agency. Some of the highlights that we're looking at in incorporating the Model Practice Act, bring out all the definitions. But there's one definition that we had some difficulty with was the definition of the practice of physical therapy. And we've changed it a little bit. I think it's simpler and it's more clear. It's been vetted by the Federation. And I'd be happy to, if you guys want to email me, share that copy if you're interested in looking at it. Currently, our draft is still with Legislative Council. We hope to expect it in the next few weeks and making it public for other people to see. We'll also have things on sonography, prescription for DME, disability placards, term protection, and then hopefully helping with removing some of the barriers for licensure for PTAs. Just recently, I shared some of the things that we're doing as a committee with a PT that practices in Camas. And he was so excited that he thought that it would be great to come back to Oregon and practice again. So, if we survive some of the traps and pitfalls getting through, the legislative process, hopefully this will resolve some of the workforce issues that we have here. Any questions that anybody has? Thank you.
Thanks so much, Noel. Other bills, there are just a baker's dozen of compact bills for other health professions. Even though this doesn't impact this agency directly, because PT is one of the pioneers in compacts, we are getting a lot of questions about how's it been going, what's going, what are the impacts? Are compacts good? Are they bad? So I am anticipating that this could involve a lot of need for testimony or at least written advisory documents for those committees, for those compacts. There are going to be a number of bills related to data equity. I know that's one of the topics is to give you an update on the Data Equity Summit that will come to a future meeting. And specifically in one of them, as an example, capture of tribal affiliation in collaboration with the federally recognized Indian tribes in Oregon. And if you think in terms of those of you that are professionals, when you renew and fill out the OHA survey, so this would tie into additional questions around that, and then a data collaboration with the tribes for that information. There's a bill to modify the Impaired Practitioner Program to introduce more flexibility for health boards and participants. You had a speaker about 6 months ago that came forward. The current program that's statutorily available for health professional boards is very cost prohibitive. And so we historically have not been a participant. Nursing, medical board, and dental boards, I think, have been the primary participants. The bill is looking to create other opportunities that would be more practical, more affordable in support of impaired practitioners and monitoring programs and those kinds of assistive programs. And then a bill to require health insurers to pay providers who are joining an in-network practice the same as in-network providers during the credentialing period. I know Gala is seeing this more and more, that the credentialing process, it is a barrier and a need to getting people licensed in order that they can start the credentialing process. And this would, at least in-network practice, mean that if they're in that candidate, they can start treating patients, seeing those providers in those contexts. That's just a preview. As we move through this, you'll get a document with all the bills, summaries, where it is at your March and May meetings. If you can scroll to the reminders and resources, This is a little advisory information for members, but also some resources for anybody who wants to engage in the legislative process, which I strongly encourage. Keep in mind that executive branch agencies, that you as board members do not have position, you have no position on any bill other than the governor's bills and priorities that she's directed, unless we specifically get authorization to do so. Having no position on the bill is different than being neutral on a bill, because being neutral is still a position. If you were to testify on behalf of the board, and when I testify, we have no position, but what we can do is provide technical feedback, testimony, expertise, input, and you can discuss bills. What you can't do is say that, you know, this is, we're against this bill or for a particular bill. So one of course, probably the most notable thing is that for the associations bill that's being introduced, the agency has no position on the bill, but we can have technical conversations and collaborate that way. Board members and staff can advocate personally on any bill, but you need to be clear that you are not representing the agency in your testimony unless you've been authorized to do so, and that's while you're there. It's very important that two things, that to know that you absolutely have the right to participate in the legislative process. If you go and testify on any bill, you just need to be clear to the legislative members that you're there personally and not with your board hat on that. And we do ask if you can just let us know that you're going to be testifying. And that way we can let the governor's office know in case there's a legislative member who thought you were there on behalf of the board, and we can make sure that that's very clear. If you're interested, there are some links here for daily information, bill information status, all the committee schedules. The links in the bills in the middle part of the document take you to that system. And then I also threw in a site for information on finding your legislator and information on how to testify available there. So with that, I'll pause, ask if there's any questions about session, the process, or our role. Okay. It's going to be fun. Next item that we have is some information for you with regard to the SCRA, or the federal licensure portability law. On that, we've mentioned this at a couple of meetings. What then happened is at the end of session bill in December, House Resolution 5009 federally included modifications to Section 705A related to portability. And that's part of why we haven't yet brought forward discussion on rules, because the underlying law changed. So the next document in the packet is a couple of pages that are the draft of the law out of the bill. The first page, and then the section that we're talking about. And they did what we often call a gut and stuff in bill terms, where they've completely replaced the original bill language. So if you go to the table, Sarah, the crosswalk. In this document, what I did is I took on the left side is the existing, or the prior, now prior federal law, and mapped it against the same sections with the new law language that's been in effect since the 23rd of December. There are a lot of parallels, but what you can begin to see through this document is that they've created more specificity in many of the definitions. One of the other things that they've done here is added a concept that if an entity cannot issue a license within 30 days, then they're required to give a temporary permit until such time that that license is available. Scroll down, please. On the next page. One piece that's going to help for the rulemaking is they've added a very specific application process and what constitutes that application. You can see it was one sentence in the prior law, and now it's several sections of exactly what is included. And scroll forward. Here you see at the top of the page, they added background checks. If you scooch back just, yep. Which was not something that was apparently allowable in the prior law. They make it clear that a board or agency can require a background check. And that background check can actually happen before the 30-day clock starts in the prior sections. What was removed that you see on the left-hand side in the prior part 3 was the ability to, with the language, submit to the authority for standards and fulfillment of any continuing education requirements. The language around submit to the authority or follow the law of the jurisdiction is there in other sections. But what was removed was the ability for the licensing entity for you to require any continuing educational requirements. So on the application, the impact is no pain management and potentially, I think we would probably need to seek legal advice on whether or not the JAM, the jurisprudence assessment, would fall under that or not. Interstate compact language is pretty similar. Basically, what this says is if they're coming from a compact state, they have to get a compact privilege. One of the things that does for you is it cuts down the number of folks that would need to make this application probably pretty significantly, given the states that are part of the compact and the military presence population in those states. Next page. And then they added some additional definitions that are very helpful. So this section is informational. It is the basis for the future rulemaking. We'll probably have some at least draft language that comes to you to handle this. This law is in effect. So if somebody were to come to the board, we would be obligated to license them under this section. They have multiple other pathways in Oregon, and we're pretty darn effective at getting regular licenses issued. So our intention is to create information on the website, sort of a flow chart so that they know all of their options. And then until we have the rules on the books and an online application, if you will, we're envisioning that this is a manual process that we can assist them through. As far as scope and numbers, I can tell you for because they have to have military orders into Oregon, there aren't that many opportunities. It tends to be Corps of Engineers, VA placements. So of the military spouse temporary permit, I believe we've had only 2 or 3 over the, I think it's probably 4 or 5 years at this point that that's been into effect. So low numbers of population, but it is federal law. It is something that we're required to comply with. And so we'll move forward and draft rules for your consideration over the next couple of months. Any questions? All right. Next slide. Any old business? Madam Chair, we don't have any to bring to you.
Okay.
And unless anybody else has anything on old business, then I think the next slide is the end of the meeting.
All right, thank you. The time is 10:07 a.m. and the Oregon Board of Physical Therapy is adjourned.